As a medical doctor, I'm sure your training was similar to mine in that Western medicine, for all its indubitable and miraculous attainments, misses the mark in some very essential areas. Because what it does, it separates some factors that cannot be separated in real life. It separates mind from the body, and it separates the individual from the environment. So when it comes to understanding cancer, for example, it's always looking for the cause of cancer either in some external toxin like cigarette smoke or in some genetic problem in the individual. But the idea that cancer may have something to do with a person's emotional life and stresses throughout a lifetime, and their psychological and social relationships with the environment doesn't enter into the thinking of mainstream medicine. Which is really ironic because the pioneering and great medical teacher, Sir William Osler, who is really still idolized in Canadian medical history, one of the great medical teachers of all time in any language, in 1892, when he wrote his textbook of medicine, he said that rheumatoid arthritis, for example, is a nervous system disorder caused by worry and stress. And Osler also said that if I want to know whether or not a man will survive tuberculosis, I need to know not what's in his lungs, but what's in his head. Now, at the time, he had no research whatsoever. There was just no science to prove the truth of what he was saying. He was working purely on intuition and observation. Since his days, over 120 years ago now, his teachings have been fully validated by science, but medical practice, far from catching up with the science or even catching up with his pioneering insights, completely ignores that wisdom. And yet, for example, when it comes to HIV, a whole number of studies have shown that survival is affected not only by the quality of the treatment, which of course is important, and nobody can deny the miraculous advances made in the treatment of that condition in the last decade or more, but that still people's emotional stresses and their social connections have a lot to do with how well they do with the disease. So that you can't separate the emotions and the psychology from the physiological. That's the first point. The second point is that you can't separate the individual from the environment. Not when it comes to understanding anything. Not when it comes to understanding cancer, not when it comes to understanding rheumatoid arthritis, not when it comes to understanding HIV, not when it comes to understanding childhood developmental disorders like ADHD and all the various diseases that kids are being diagnosed with left, right, and center, not when it comes to addiction, not when it comes to anything. There was an article in this February's journal Pediatrics, which is the leading pediatric journal in North America. The article came from the Center on the Developing Child from Harvard, and they actually argued, and they showed, collated a lot of research, that social and physical environments that threaten human development because of scarcity, stress, or instability can lead to short-term physiological and psychological adjustments that are necessary for immediate survival and adaptation, but which may come at a significant long-term cost in terms of learning, behavior, health, and longevity. In other words, the things that children do to survive stress in the early years, not that they do them consciously, but the adaptations that they're forced to come to, those same adaptations that help them survive their childhoods actually make them sick later on. And the case I'm going to make for you today is that whether it comes to addictions, whether it comes to childhood disorders, mental health issues, or even physical illnesses like cancer, rheumatoid arthritis, and so on, it's all based on childhood adaptation, and that the common theme, the common source of all human illness is actually a disturbance in people's attachment relationships. Now, attachment is the drive of a person to be close to another person. So it's the drive for proximity, the seeking of closeness for the purpose of being taken care of or for the purpose of taking care of somebody else. Now, attachment is simply the most important human drive. We're wired for attachment. We're biologically, instinctually programmed to attach for the very simple reason that as infants, we're the most helpless, least mature, and stay that way longer than any other creature in the universe. So that we don't survive without attachment, nor as a species would we have survived but for our social relationships. So quite contrary to the capitalist myth that people are individualistic, egotistical, competitive, and aggressive, we're just the opposite. We're actually social creatures wired for love, wired for closeness, wired for attachment. And when those attachment dynamics are disturbed, everything else follows. Now let me give you 3 examples of what I mean. And this perspective has been called the biopsychosocial perspective. Biopsychosocial means that the biology of human beings is inseparable from their psychological and social relationships. So, how do you explain certain things? Studies that show that if your parents are divorced, your risk of a stroke doubles 60 years later. A recent study, men sexually abused have tripled the rate of heart attacks as adults. Not to mention multiple the rate of suicide. Girls whose fathers are distant emotionally are going to menstruate earlier than girls whose fathers are close to them. Women followed over a 10-year period in the United States, 1,700 women, married women. Those that were unhappily married but didn't express their emotions in that 10-year period were 4 times as likely to die as those women who were also unhappily married but did express their emotions. So the difference wasn't unhappiness or happiness. The difference was, did you express who you were? Did you express your feelings? Or did you suppress them? How do you explain such facts? How do you explain that in Canada, in the 1940s, the gender ratio of multiple sclerosis was pretty much 1-to-1, maybe slightly more women than men? You know what it is now? 7 years later? It's 3 or 4 women to every man. Now, you can't explain that genetically, because genes don't change in a population over 70 years. You can't explain it by diet or climate, because that hasn't changed more for one gender than the other. Something has happened. And that's something I maintain has to do with psychological and social relationships. Now, let me give you clear examples of this throughout the life cycle. It's been known now for a while that children whose parents are stressed are more likely to have asthma. So in polluted areas where there's, of course, more irritants in the air, kids are more likely to have asthma. But even in those areas, it's the kids of parents most stressed who are most likely to have the asthma. Now, if the child is taken to the average physician, Western-trained physician, he'll be given, or she'll be given, a treatment for asthma in the form of inhalers. Now, anybody here ever been treated for asthma, by the way? Yeah? Okay, what did you get? What did they give you? Do you know?
I got a bronchial dilator and Clomid with steroid.
Exactly. So you got a bronchodilator because your bronchi were narrowed. So you got something to dilate your bronchi, to open them up. And you got a steroid because in asthma, there's inflammation of the airways so that there's cluttering and swelling and further obstruction of the airflow. Hence, we give you something to suppress the inflammation, which is a steroid. Now, since this is a healthcare-oriented audience, some of you might know, it's okay if you don't, but what are these inhalers copies of? Anybody know? What are they based on? Well, the bronchodilator is a copy or an analog of adrenaline. And the steroid is a copy or analog of cortisol. Now, surely many of you know what cortisol and adrenaline are. What are they? They're stress hormones, exactly. In other words, we're treating asthma with stress hormones. But in fact, if you had a sudden asthmatic episode, status asthmaticus, where your lungs really shut down, you'd be rushed to hospital, you'd be given an injection of adrenaline and an infusion of cortisol. Well, we never ask ourselves, gee, we're treating it with a stress hormone, could stress have something to do with it? As a matter of fact, when you think about it, and Anne will back me up on this, that the commonest medicine used all across medical practice, whether it comes to inflammations of the skin, the joints, the intestines, the nervous system, certain cancers. What is it? It's cortisol. We treat almost everything with stress hormone, but we never, psoriasis, we never ask ourselves, does stress have something to do with it? Has something happened to the stress regulation apparatus of that individual that we have to give them extra stress hormones in order to keep them in a healthful balance? Now, why the children of stressed parents? Because the emotional states of the parents affect the physiology of the child. And when the parents are stressed, the kids are stressed, and the stress mechanism get overwhelmed, now we have to give them extra stress hormones to keep their airways open. So it's biopsychosocial. You can't separate the biology from the psychological and social environment. Similarly, in a study in Australia, they looked at 500 women who had breast biopsies for suspicious lumps that had to be checked for potential malignancy. And before the results came back, these women underwent a psychological interview. When the results were collated, it turned out that if a woman had a major stressful episode prior to the onset of that lump, that by itself did not increase the risk of the cancer, zero effect. Similarly, if a woman was emotionally isolated, that by itself also did not increase the risk of the cancer, zero effect. So far, so good. But if a woman was emotionally isolated and stressed, the risk of that lump being cancerous was 9 times as great as the average. Now, the researchers, being medical scientists, had no way to explain this, because to the left brain, how does 0 and 0 add up to 9? How does 0 and 0 multiply to 9? Now, can anybody here suggest the explanation? Very straightforward physiologically. Any hazard a guess? What's the connection here? Well, okay, think about it. When you're stressed, it's not just this is not a psychological event. Again, this is what's so ironic, because just as Osler was a great Canadian medical teacher, the work on stress was actually done here in Canada. The research on stress, the research that showed for all the world what the physiological effects of stress are, was done at the University of Montreal by a Hungarian-born physician like I am. His name was Hans Selye. And he's the one that did the seminal work on stress. He nearly won a Nobel Prize for it. In fact, he's the one that coined the word stress. Stress is a Canadian word, did you know? He's the one that coined it in the way that we use it today. I mean, the word existed, but he's the one that adapted it to that particular usage. So when you're stressed, it's not just that you're upset or perturbed psychologically, it's that your body homeostasis, your body's internal biochemical balance shifts. What happens is that in response to emotional messages from the brain, for example, if I were to scare you right now by threatening you with a weapon, then those emotional triggers would send messages to a master gland in the brain called the hypothalamus, which would then affect another gland called the pituitary, which would then send messages to the rest of the body, including there'd be messages sent to the adrenal gland on top of your kidney, and then the adrenal gland would release these 2 hormones, adrenaline and cortisol. And the job of adrenaline and cortisol are to help you fight or to escape, the flight or fight response. So they give you more energy, they elevate your sugar levels, heart rate, tense your muscles, prepare you to defend yourself in the short term. But in the long term, those same hormones, if the stress is chronic, damage your body. Adrenaline will give you high blood pressure. By the way, it's very interesting. In medical terms, we talk about what they call essential hypertension when it comes to high blood pressure. So that, there's some identifiable causes for blood pressure, such as kidney disease or other conditions, rare conditions. But most people with high blood pressure, we say, we don't know what causes it. That's only because we're not listening to ourselves. As I just said, in medical terms, we call high blood pressure hypertension. Think about it. Too much tension. Too much tension in people's lives. Too much adrenaline. That's what causes high blood pressure. Most of the time. And I know for myself, that I'm prone for high blood pressure. When I get very stressed, my blood pressure goes up. I don't take medications. I take my high blood pressure when it happens as a sign that I'm too stressed, and that I got to deal with the stress. And my blood pressure is usually, in a low range. But if I ignore my own advice and permit myself to get overstressed, it goes into very high levels. So, over a period of time, the cortisol also causes ulcerations in the intestines. Now, this is very interesting, because the one disease that used to be understood to be a stress-related disease even by Western medicine were ulcers. And then lo and behold, in the 1990s or late 1980s, we discover that there's a bacteria implicated in ulcers called Helicobacter pylori. And if you give antibiotics, you can cure the ulcer. Aha, doctors say, so much for the stress hypothesis, it's all the bacteria. Huh. Well, guess what? At age 40, 40% of the population has the bacteria in their stomachs. At age 50, 50% too. At age 60, 60% too. But do 60% of people have ulcers? If the bacteria cause the ulcer, why doesn't 60% have ulcers? Because it's the stress that makes them vulnerable for that bacterial damage. You don't separate the one from the other. You don't separate the one from the other. So cortisol also thins your bones. Women, for example, who are depressed, who've got higher levels of cortisol, are much more likely to have osteoporosis. And yet when the Osteoporosis Society does its public educational work, they never talk about stress. They talk about exercise, quitting smoking, they talk about calcium, vitamin D, sunshine, good stuff. But they don't talk about stress. It's the thing that we ignore all the time, and yet I think it's the most important factor in health. In the long term, excessive cortisol can also suppress your immune system. And we know this. So now, go back to the Australian study then. How do we understand this finding of isolation and stress 9 times as great as average of cancer risk? If one of you was stressed right now, something happened, you lost a job, economic loss, perhaps you lost a relationship, and you're really upset, again, your stress hormones would be higher. And if you're all alone with that, if you're emotionally isolated, you'd be basically obsessing and thinking and suffering over that stress for a long time. And that means for a long time, your body would be under siege from your own stress hormones. But what if you weren't emotionally isolated? What if a friend came along and said, and by the way, when I say this, think about the work that you're doing. Think about the importance of the work that you're doing on the physiological level. What if a friend came along, or somebody who cared, came along and said, well, I see that you're having a hard time. Do you want to talk about it? What would happen immediately to your body, to your physiology? Well, the first thing that happens is you take a deep breath. Yeah. And oxygen would go to your brain. You start thinking more clearly. And your blood pressure will go down. And your adrenaline levels would abate. And your cortisol levels would fall. And your body would come back to a normal physiological state. Then you'd be protected from the immune suppressant effects of the cortisol. No wonder then that the women who are isolated and stressed are 9 times as likely to have cancer, which also tells us that cancer is not an individual disease. Cancer reflects a lifetime relationship with the environment. And I could give you a whole talk about that. Not just the physical environment. See, it's easy enough to say that smoking causes cancer, except we all know that smoking does not cause cancer. Don't we? If smoking caused cancer, then everybody who smoked would have cancer. But most people who smoke don't have cancer, which doesn't mean that smoking doesn't contribute to cancer. Of course it does. It's a major risk factor. 95% of people with lung cancer are smokers. but it's not by itself the cause. When you actually look at the lives of people who get cancer, they're also people who suppress their emotions. And the more they suppress their emotions, the less smoke they need to trigger the cancer. So we have to stay away from this idea that single factors cause disease. So cancer doesn't just reflect. And by the way, why do people suppress their emotions? Well, that has to go back to their attachment relationships early in life. Because no 2-day-old baby ever suppressed their emotions. Nor have you ever met one. So the suppression of emotion is an adaptive response. Remember that article from Pediatrics? It's an adaptive response to an environment that can't handle your emotions as a child. Then you learn to suppress it as a way of adapting, as a way of surviving. But then that same adaptation becomes a cause of pathology later on. Think of depression. You think, well, there's nothing adaptive about depression. Yes, there is. What is depression? What does the word depression mean? It means to push something down, right? You depress the pedal. What do we push down when we depress our emotions? Well, I was going to say, what do we push down when we have depression? We push down our emotions. Is there survival in pushing down our emotions? There sure is, if our parents can't handle them. Then in order to maintain our attachment relationship with the parent, we suppress our emotions because we sense that they're too stressed and they can't handle it, and then we become depressed. So that's an adaptation that later on becomes a source of pathology. Just as emotional self-suppression potentiates cancer, but that emotional self-suppression begins as an adaptation. So as somebody very astutely said in a New York Times series on cancer a couple of years ago, that you can no more understand, or trying to understand cancer by studying the individual cell is like trying to understand the traffic jam by studying the internal combustion engine. Okay? You can't do it. You have to do it. You have to study the relationship of that individual to the environment. And that's why, for all, I hate to tell you, but all the march for cancer and all the research, never going to get anywhere. They're going to come up with billions of dollars worth of research, and they're going to come up with treatment modalities that extend life by a few months. And in a few cases, will cure some cancers. But for the most part, they'll never find the cause of it because they're looking in the wrong place. They're looking inside the cell. That's not where the cancer originates. Because the other thing that we know now is that cells don't exist autonomously. Genes don't act autonomously. Genes are actually turned on and off by the environment. The whole study of epigenetics is how genes are actually activated or inactivated by the environment. So a study out of McGill University, just within the last couple of years, looked at the brains of suicide victims. And they knew who had been abused as a child and who hadn't. And in the brains of people who had been abused as kids, there were particular genetic changes that was caused by the abuse. And at University of British Columbia, within the last year, they showed that when they looked at the genetic functioning of teenagers, a whole number of genes had been affected in the teenager by stresses that the mother had in the child's first couple of years of life. And a bunch of other genes were affected by stresses on the father when he was a little bit older. In other words, when the primary relationship is just with the mother, then it's the mother's stresses that affects the genetic functioning of the child who later becomes a teenager whose genes are still affected by what happened to the mother in the first 3 years of life. And then later on, stresses on the father. So that genes don't, by themselves, explain very much, unless we recognize that genes are actually turned on and off by the environment. And that's what I mean, again, by this biopsychosocial understanding of human beings that is so foreign to the practice of medicine. So that's the second example, these women in Australia. The third example of what's been called the biopsychosocial approach is, if you look at a study in the New England Journal of Medicine 3-4 years ago, elderly people who've been together for a long time, an elderly couple, when one is hospitalized, what do you suppose happens to the other one? They're much more likely to die. The physiology, the very immune system of the one is significantly influenced by the emotional relationship with the other. When all of a sudden that emotional relationship is lost, death has a greater risk of occurring. And many of you have seen examples, I'm sure, that in couples who've been together for a long time, one of them dies, the other one succumbs very quickly afterwards. This is not universal, because it depends on the attachment relationship and how individuated that person is. If they rely totally on the relationship for their sense of self, the more susceptible they are. And that reliance on the relationship was an adaptation early in childhood. When you look at people's behaviors, when it comes to the spread of the HIV epidemic, I remember reading a book quite some years ago now. I think it was called When the Band Stood Still, by Randy Shills, was it?
Yep.
A journalist from the States who himself died of AIDS later on. And in the book, he describes he traces the rise of the HIV epidemic, and of course it was abetted in large measure by the incredible promiscuity of homosexual males on the West Coast and elsewhere. I mean, it was incredible. People would have sex across a hole in the wall with some total stranger. But that promiscuity is not a moral failure, nor is it a bad choice that people make. It's actually an adaptation, which is the same is true in heterosexual promiscuity. There's nothing about homosexuality that itself causes promiscuity, because basically, truly, I think we're monogamous by nature. The promiscuity is a desperation to be loved, a desperation to be found desirable, a desperation to be wanted. Where does that come from? In every case, it comes from your early relationship with parents. When you didn't have that sense of being wanted and loved and welcomed and accepted and being desirable. And very often these guys would have very bad relationship with their fathers. Then, of course, you will engage in behaviors that'll prove to you that you're desirable and lovable and wanted. So it's an adaptation. It's an adaptation that then becomes a source of pathology later on. So it's with that perspective then that I think we can understand almost all, and I know that sounds like a heck of a mouthful, but almost all human disease and psychological dysfunction. If we understand, number one, the importance of attachment, and number two, the desperate adaptations that people will have to make if their attachment needs are not met early in life. Now, and that is true of addictions as well, which I'll come to in a moment. Now, I first became interested in childhood development when I was in family practice, but most specifically when I myself was diagnosed with ADHD, attention deficit hyperactivity disorder, at age 54. And what happened was that I was working in palliative care at the time. I was the coordinator of the palliative care unit at Vancouver Hospital, looking after the terminally ill, and the social worker on the unit, age 38 at that time, came to me all excited one day and said, "Hey, I gotta have coffee with you." I said, "Okay, let's have coffee." And so we did, and she told me she'd just been diagnosed with ADHD. And she told me all the symptoms, hyperactivity, difficulty focusing, poor impulse control, tuning out, absent-mindedness. And of course, within 3 minutes into the conversation, I fully understood why it was with me that she wanted to have coffee, because I completely recognized myself in everything she said. Now, if we look at what's happening with kids these days in North America, an increasing number of kids are being diagnosed with ADHD. The number of stimulant prescriptions in Canada has gone up 43% in the last 5 years. When I wrote my book on ADHD 12 years ago, it had gone up, I think, fivefold in the previous 15 years. So it keeps going up and up and up and up and up. In the United States, 10% of children are not said to meet the diagnostic criteria for ADHD. In the States, there are 3 million kids at least who are getting stimulant medications, 500,000 children who are getting antipsychotic medications. Tens of thousands of kids in this country probably are getting antipsychotic medications as well. Antipsychotics like risperidone and Seroquel, such as we give to adult schizophrenics to control their psychosis. We're not giving it to kids to control their psychosis. Why are we giving it to them? To control what? To control their behaviors. What we've got now is a massive experiment in the chemical control of children's brains. We have no idea, because the research has not been done, of what are the long-term effects of antipsychotics on children's brains. We have no idea. What I do know is that in Children's Hospital in Vancouver, they've had to establish a clinic just to deal with the side effects of the antipsychotics, which include obesity, skin problems, cognitive problems, behavior problems, and so on. But we don't know what the long-term effects are because these are off-label uses. The number of children being diagnosed with autism has burgeoned. It's 30-fold in the last 40 years, or I always forget whether it's 30-fold in the last 40 or 30-fold or 40-fold in the last 30. It's something incredible. The number of kids being diagnosed with anxiety, bipolar illness, depression, conduct disorders, oppositional defiant disorder, going up and up and up and up. And if you ask most physicians what causes the problem, the official explanations for ADHD, for example, it's a genetic disease, which is inherent nonsense, because genes don't change in a population that quickly. Now, you could argue that it's not that the disease is going up, it's just that we're better at recognizing it. But that certainly doesn't seem to be the case. We're just seeing many more kids who are troubled. And anybody who's been in education for 30 years or psychology will tell you that. So I became interested in that when I was diagnosed myself. And I'll just read you something from my book, Scattered Minds. How did I respond the very first day I heard about ADHD? Because I knew nothing about it. Now, one of the one of the hallmarks of ADHD is poor impulse control. Impulse control means that there needs to be a part of the brain that puts a damper on your urges to do things. Now, the impulses don't arise from the gray matter. They don't come from the cortex, the thinking part. Impulses arise from more the lower emotional centers. You see something, you want it, for example, or something occurs to you and you want to do it right away. And by the way, who's like that? Who has no impulse control? Normally, very young kids, because the impulse regulation circuits in their brain haven't developed yet. So there needs to be circuitry to control the impulses. So the job of the cortex, the gray matter, is not so much to initiate impulse as to inhibit impulses. So in ADHD, there's lack of impulse control. What's another large group of adults who lack impulse control is addicts. When you do brain scans on drug addicts, the commonest brain finding is that the part of the brain that regulates impulses doesn't work. Which, by the way, is right here, behind the right eye. It's called the right orbitofrontal cortex, which is astonishing because for thousands of years, when people want to indicate that somebody's a little bit funny, they go what? They go... In Hungary, we went like this. In North America, you go like this. How did people know that it's the right orbitofrontal cortex? But somehow they point exactly to the right spot for people that lack impulse control. So, what we've got right now is an epidemic of impulse regulation problems amongst our kids. The oppositionality, the conduct disorders, the Asperger's, the Tourette's, the ADHD, the autism, these all have impulse regulation as one of its salient deficits. So, to come back to my own story, with an impatience and lack of judgment characteristic of ADD, I'd already begun to self-medicate even before the formal diagnosis. A sense of urgency typifies attention deficit disorder, a desperation to have immediately, whatever it is, that one may desire at the moment, be it an object, an activity, or a relationship. And there was something else here too, well expressed by a woman who some months later came for help. It would be nice to get a break from myself, at least for a little while, she said, a sentiment I fully understood. One longs to escape the fatiguing, ever-churning, ever-spinning mind. I took Ritalin in a higher than recommended initial dose on the very day I first heard about attention deficit disorder, on the principle that if a little bit of Ritalin is good, then more Ritalin would be even better. And don't try this at home, kids, but I could do it as a physician. I could do this because I went to one of my palliative care colleagues and I said, hey, Bev, I think I've got ADD. Can you give me some Ritalin? Oh, sure. How much do you want? Secrets of the medical profession. Within minutes, I felt euphoric and present, experienced myself as full of insight and love. My wife thought I was acting weird. You look stoned was her immediate comment. Well, the Ritalin really did help me focus, and within a couple of days, it made me very depressed. That was its side effect on me. That may not be its side effect on you, but that side affected me. I did see a psychiatrist. I was formally diagnosed. I was given Dexedrine, which helped me focus. I was writing a medical column for the Globe and Mail at the time, so the Dexedrine helped me stay up at night and be a much more efficient workaholic than I used to be. And, but right away, the idea that this is somehow a genetic condition made no sense to me. And the reason that the genetic, even though a couple of my kids have been diagnosed, and the reason it made no sense to me that this is a genetic condition was very simple. The hallmark of ADD is the tuning out, the absent-mindedness. Now, tuning out is not a disease, genetic or otherwise. What is tuning out? What is it? It's a protection. It's a coping mechanism. A coping mechanism against what? Against overwhelming stress. So if I were to stress one of you right now, in this environment, you'd have a number of healthy options. One healthy option would be to assert yourself and to fight back and say, hey, stop it. The other healthy option would be just to walk out. I didn't come here for this, and just walk out. And given that there is, I don't know, a couple of hundred people here in the room with you, if you couldn't walk out or fight back, you could always ask for help. But if no help was available, if you couldn't leave or assert yourself, then you might tune out in order to protect yourself from the distress of the stress. So the tuning out is an automatic brain mechanism. Soldiers do it when they're wounded. They'll tune out the pain, so they keep running away from the enemy until help arrives and then they can collapse. So tuning out is a nature-granted coping mechanism, a dynamic in the brain that allows circuits to be switched on and off. And so then the real question in my mind becomes, why do more and more kids these days find themselves tuning out? What's causing that? Now, the part that I didn't know, because nobody had taught me in medical school, and I doubt very much whether you were taught this in medical school either, and I doubt very much that they still teach it now in medical schools, is how the human brain actually develops. And I'll come to human brain development in a few moments. But let me speak to you now about addictions and trauma.